carpules on 29 and 30. Yes. Okay. So this is your syringe assessment. And you can have, thank you, Dolly, you can have the topical already in their mouth when we come in. When I put my, Dolly, sorry. I have a garbage bag taped to the side of Op 3's mobile cart. Grab that from, it's got the, yeah. So we are going to put one back here for our block, pass a retromolar pad, and then we're going to do a supplemental injection since 27 is so far away from back there. We're going to put a topical there too because we're going to do another injection there. Thank you very much. Sorry about that. So another thing.
It doesn't always want to stay there.
It doesn't want to. Garbage bags, good idea. You can also have a paper cup for any infectious waste that you have on your tray. Okay, Sonia? You guys already know how to do this, right? Please try to put your garbage in the garbage bag as you go, as opposed to now putting those sticky, saliva-covered Q-tips on your tray. Would you like another carpule, doctor?
Please.
Leave the carpules on your tray even if you have a sharps container in your operatory, because you need to document how many carpules we used. Label back up. And Rachel pointed out something yesterday, I can't remember if it was Rachel or Amanda, but the second carpule, if we're using the same anesthetic, is not nearly as important to turn the label up because the doctor already verified it on the first carpule. So you don't need to spend a lot of time making sure that that label is where it's supposed to be. Okay, so give him a rinse. Just, I turned that off. Just in the quadrant we injected in, just like your syringe assessment. Okay, so now before we put the rubber dam on, we need to pick a shade for the composite because remember the rubber dam is going to dry their teeth out and change the shade. So you can, my habit is just to turn this down. Some students will turn it off completely. I don't care which one you do. And you can pick out a shade ahead of time and then just verify with the doctor. I thought A2 or B2 or whatever shade. I think A2 looks good, doctor. What do you think about that?
Great.
So she wants me to clamp 31 and carry it to the midline, because she told me that, for the rubber dam.
Oh, so you tell them what to do?
I do.
I just say quadrant.
Okay.
Okay.
So do you want him to go 1 or 2 teeth distal? Do you want second molar to midline?
Yep.
There you go. So if you have Miss L, do second molar to the midline. If you have me, I'll tell you what to clamp and where to carry it to.
It's habits.
I know, it is. One thing about the shade guide, students have a tendency to match the shade guide to 8 and 9 because they're the most visible. We're not working on 8 or 9, we're working on 27, so you need to match it to the tooth we're working on, okay? And I pulled this out a little bit so that I don't forget what shade we're using when it comes to the composite.
It's just up a little bit, yeah. Okay, just so it stands up.
So at this point, we would leave. No, you're fine.
Okay.
We would leave, and you have 5 minutes to put your dam on. So if you have already tried to clamp on and punched your dam, right now, all you have to do is put it on. Turn on 31.
My students are finding that this is, a real person is a whole lot different.
Oh, yes.
Gum tissue doesn't resist as much as like Dexter's gum tissue does.
Yeah. Some things are easier on a human, some things are harder.
And they're a little tentative because they're afraid they're going to hurt. And I say, no, they're numb.
Yes, hopefully.
So did they say it was easier or harder on the harder?
It's harder.
I think they're more nervous about a human being than they are, you know, Dexter.
You do that same.
Okay.
I just
And
want to rip it. Oh, come on, then, Debbie. There you go. I'm fine.
are you timing me? Thanks, Lori. I appreciate it.
Yeah. Where did you get this one?
I know.
Do you have them use the top
2 minutes.
or
I don't.
it's in there. It's right between the first and second. Yeah. So Very nice punch.
Well, thank you,
That was
doctor.
really awesome. Mine, I always mess up on when I'm doing
Well, I
that.
looked at it and went, that's not going to be pretty, but it turned out okay.
You did.
In some offices, the doctor will stay in here. The doctor I most recently worked for, we put the dam on together. So, we stretched it on the frame together. It was just so much
where the
faster.
Estes are, though, they don't do anything. Come in, gone.
Oh, really?
Yeah, oh, man. They must drink more coffee than anybody on earth. I swear to goodness.
The EFTAs.
Mm.
They're busy.
Yeah, the doctors, I mean, they come in, they eject, they
Oh,
go.
got it.
They leave everything to the EFTA and the assistant.
Right.
So.
Okay, so check and make sure it's inverted, just like you would do on any of your other rubber dam assessments. How'd I do, Lori?
Wonderful.
Good answer.
So now, again, don't assume after 5 minutes we're going to come in. You may have ripped your dam, you may be still struggling with it, you may be punching it. You need to come and tell us when you're finished with the dam, and then we will come in. Look at your in there.
Because we are in our office drinking coffee, making our golf dates.
Exactly. Yes, reading the newspaper, talking to our buddy.
Getting
Or
our
down the
wife's
hall.
shopping list.
Down the hall if you're in a joint building.
Oh, yeah. There's that.
Just for clarification, we're gonna have to like punch a whole bunch of teeth for the dam.
You're going to do a normal rubber dam like a quadrant. Yeah.
It just takes a second to go up.
Okay, so when we come back, sorry, skip the step. Mouth Mirror and Explorer to check the dam, just like we do for your rubber dam assessment. And then she's going to keep her mirror so that she can see what she's doing. I'm going to hand her the high speed is always first. You have to prep the tooth first before you can take the decay out with the low speed. Okay. And then you're going to place your suction. There you go. Got it right here. Okay. One tooth distal to the tooth we're working on. Can you guys see that? Up behind you. The top of my bald head. You think?
Yeah, no checking out the gray. I haven't had a hairdo yet. I haven't had a haircut yet.
So she just moved away from, she took the high speed, she stopped the rheostat, and she moved, kept her fulcrum, but moved the handpiece off of the tooth. Without saying anything, she's telling me she wants me to rinse the prep so she can see where she's at. So we're not going to tell you to rinse, but every time we stop and we take our handpiece out of the tooth, rinse.
You just go like this, right?
Yep, exactly. Okay. And it's an air water spray directly down the long axis of the tooth, so get on top of the tooth, and it should be about the same angle that the burr was at in the handpiece. Air water spray, suction, get out. Okay? I know, it's a little intimidating.
No pressure back
Yeah,
there.
look at what it's
I
doing.
know.
You can pretend if you want to. Right
That's
up
okay.
here.
I have a habit to come out, guys. Okay, so
I probably do too, and I
either
don't
way,
realize
so
it.
as long as you see us stop and come out, just go in there. I'm gonna try and tighten this for you, but see if I will do anything. But it's coming out this end, not.
Okay.
Can I have a 34?
Sure. So she's done prepping the posterior teeth with the 557. So she wants a 34, which is a inverted cone. So if you've set up your burr block so that you know where you put your inverted cone, that will just take you a second to find it. That's one of the things that probably has a big learning curve on it, is knowing your burrs. And they are so tiny that you need to know where you put them, because you can't always tell what the shape is just by looking at it. Untangle.
Especially the older you get.
Tell me about it. I have to wear my reading glasses now when I do chairside. I can't see what I'm doing.
Well, you see what I got on.
Yeah.
And I have to close one eye because I'm monovision.
It's not a good time getting old.
Hush, y'all.
I know. Now on the anterior tooth, when I'm rinsing the prep when she moves, I'm coming from the facial of it, air water spray, I'm suctioning from the lingual, so it's different. But it's the same direction that the burr she was prepping it with. So if you watch how her handpiece is, that's where the angle you should be spraying at.
Yeah, like that.
Exactly. Yep, so she's doing lingual. I need to come from the facial. I know it's been a long time since we've done that whole assessment with the handpiece rinsing. Okay, she's done. She completely removed her fulcrum and handed me the handpiece. Make sure you push it all the way down so that little trigger knows you're not using it anymore. So now is the low-speed handpiece.
You don't have to dry it before she uses the slow speed.
She suctioned all of it over. She suctioned over it and it sucks all of it out.
Okay.
Because we don't want to dry it because it does
No,
take
totally,
the
right.
hypersensitive.
So the low-speed handpiece does not have water coming out of it, and even though it doesn't spin as fast, we need to cool the tooth down with just a little blast of air. So I'm just going on the burr itself. Don't get in her way so she can't see what she's doing, but be close enough that you're actually putting the air on the tooth. Some people are out here, it's like, that's doing nothing to cool that tooth down, okay? She moved again, so it's my turn to rinse and dry. And again, it's a teasing it dry is what they call that. The air from the air water syringe, is also blowing debris out of the tooth, so she doesn't have to have stop and have me rinse as often either.
Can I have the number 2, please?
Sure. So we're done prepping the posterior teeth, and now she needs a smaller burr, round burr, for the posterior prepping. So this is why you're doing that timed handpiece burr assessment right now, because you can see she's just sitting there waiting for me to change her burr. If I'm having to think about where is that, what is a number 2, blah, 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 then fiddle around with it, the doctor's going to become frustrated very quickly. We're going to do 2 amalgams, sorry Deb. We're going to do 2 amalgams so that if you miss a step or you hand us the carvers in the wrong order the first time, and we correct you and you do it right the second time, we'll still give you the points, because the point is that a doctor can tell you how to do something one time and you fix it. Not that you keep repeating the mistake 6, 7, 8 times. That is going to be frustrating. Yeah, I have a tendency to put that back.
I put that back.
Myself. Yeah.
That means I'm done with all of them. And that's what, do you tell them to rinse all the preps at that time?
Yeah.
Or just that one?
Yeah. Well, yeah, with the rinse them all, since we're going to be, we're going to use a spoon first, so no, let's.
Also, you guys, don't put the burrs in and out with the sterile cotton pliers.
No.
You know how you ever see them try to do that? I can't do it.
I told them when I did the burr thing, don't use the cotton. Yeah, no.
Well, it contaminates the cotton
It does,
plier.
and it takes forever and a day.
Thank you.
So just pick it out of the burr block, set it down, pick it up.
You just handed her.
A spoon
Spoon
excavator.
excavator.
And it should be the next thing on your assessment.
So you're doing all 3 teeth with the spoon
Yeah.
excavator at the same time? Okay.
And she is keeping her fulcrum, but putting it out of the mouth, and I'm wiping the decay off of it.
The small side first?
It's right and left is what it is, so there isn't a small or a large to that.
Hand either one.
Yep.
Okay.
The doctor will turn it around if they want to come from the buccal or the lingual. Okay, so now I'm going to rinse all of the preps because we're ready. The decay's out. We've done our outline form, convenience form, all of that. And now we're ready to start adding our material. So since water runs downhill,
Almost went back.
since water runs downhill, I start with rinsing the anterior tooth and then I go back to the posterior. It just makes the most sense to me.
Gravity, huh?
Yep. Okay. And I don't mind if you put a little bit of air on it. I don't want a pool of water inside the tooth, but like she said, we don't want to desiccate all those dental tubules that we talked about.
Yeah, I really like the tease dry. I mean,
Yes.
just a suction over it does most, but it doesn't
It
do
does,
it all.
yeah. So I am going to mix the liner, and she's not going to tell me what she wants for a liner. We are going to use Vitribond because that's hypothetically what our office uses as a liner. So 1 scoop of powder and 1 drop of liquid. Who caught it?
Good job.
Got that on camera.
And if I didn't catch it, I would leave it on the ground. I would not try to go get it. Students will try to mix this on their tray and the edge gets in the way. So I also don't enjoy this, mixing it here, but I don't know what my pet peeve is with that. I just don't like that. I like something stable.
I worry about it going.
True,
I can't do it.
falling,
Yeah,
yeah.
falling close, so I'm with you.
So make sure it's in a pile. I'm going to clean my spatula off because I may need it again. This is light sensitive, so turn your light down. It's like perio charting, huh? Bring foot to the extreme. Get a 2x2.
Do you tell them to get a dry 2x2 because the alcohol dilutes it?
Exactly.
Okay, good.
Yeah, chemical react something.
Chemical react. Yeah,
Yeah.
exactly. I don't know what it is, but they tell you dry.
Yeah. So this is not an alcohol 2x2. I used an alcohol 2x2 to wipe my spatula off. It's a dry 2x2 to wipe the decal applicator. We have to wipe it off every time she goes in there because if it hits the Cavo surface margin, it's going to create micro leakage on the outside. So we need to make sure there's not a big ball buildup of it around it. Wipe it off. She puts a little bit more on. Wipe it off. She puts a little bit more on. Okay. Put that back. Put your instruments back in order. So then if you ever need it again, you know exactly where it's at. 10-second cure, or 30. I'm drawing a blank, 30. And we're doing, you have to watch what teeth she put it in. She put it in all 3 teeth, and so I can only cure 27 by itself, but then I can cure 29 and 30 together, since this is a long one. If you had that other light, you would have to cure them all separately for 30 seconds, because it won't cover 2 teeth. Big handled guy. And I wasn't really watching, I'm assuming that that's what you did.
I did.
Okay.
You're right.
I thought you did that.
It's working together for 25 years.
Like an old married couple.
I know. Mrs. Wirth can read me better than my husband.
We spend more time together. It was even worse when we shared an office.
No.
Like, is that time of the month again?
I don't have it anymore.
Yeah. Cannot wait for that
Now she can
day.
say that to you, right?
Yeah, exactly. Well, every day sometimes it seems like it's that time of the month. I know you guys could feel it yesterday. Yeah, she was cranky yesterday.
But remember, y'all, she's a queen
Somebody
bee,
pointed
so.
out in class yesterday. Somebody pointed it out.
That she's cranky? Oh, you
Yeah.
don't ever want to do that.
I try to keep it to a minimum. That's right. Okay, so Gluma is our desensitizer, and we need a micro brush for this. So I just put a drop on the brush itself, pass it to the doctor.
What's that called again?
Gluma, G-L-U, the micro brush. And then you can put a little drop in the corner of the dam, so if she needs any more, she can get it for herself.
Then you gotta watch me again.
Yes, she put it in all 3 teeth. Usually Gluma goes in all teeth. The liner, remember, only goes in teeth that have deep prep. So we may not use the Vitrabond in all the teeth. We will use the Gluma in all the teeth. And it is compatible with composite, so you don't have to worry about that not being able to etch and adhere to it. Okay, so we put our liner in, we put our desensitizer in, now we're ready to put the amalgam in. So we're going to start with the most posterior tooth, so I'm going to put my Tofflmeier matrix on 30, and then we will work our way forward. And you'll be able to see, when we taught this, you were asking about being able to put more than one on at a time. You can see that I could not get another Tofflmeier on 29, it wouldn't seat all the way. So that's why we can only do 1 tooth at a time. All right, sterile cotton pliers. Get your wedge out. Put your sterile cotton pliers. And my preference is that your tips stay up. If they're down, they're too close to a contaminated surface. So I know they are still sterile if my tips are pointing up.
That's good.
Why, thank you.
Yes.
I will remember that.
I know. I always have mine down.
Oh, yeah. To me, they just get too, look at how close
Yeah,
they are. And if
that's
they're over
true.
here, I think about sterile hands, you know, too. This tip is kind of broken. So you're going to need to have watched us prep the tooth. Is it an MO? Is it an MOD? So that you know how many wedges you need. I'm going to pretend we did an MO, and 29 will be a DO. And this is why you cannot use your fingers to, get the wedge in here, is because there's too much in the way, and that's kind of unsanitary.
What, fingers?
Yes. I just...
So they're too big to get in there anyway.
Yeah, well, and if you, depending, I mean, if they're open this wide, if you depend on that, you're not going to be able to get in there.
But after you put it in, it's okay just
I
to
don't mind
shove
that.
it a little bit with
Yeah.
your finger, yeah.
Yeah, and make sure it's in there. My preference is that you use the back side of the cotton pliers, but if it's gone to a funky angle, like she said, I don't mind if you use your finger. Okay, so your amalgam well needs to be on your tray so that if any of the amalgam goes up and over the edge of the well, it's on a contained surface. It's not on the mobile cart and going to go on the floor. So that needs to be on your tray, unlike trying to mix your Vitrabond on the tray. 10 seconds, medium.
How many seconds did you give him for loading?
30. It took me 12, so I gave him 30. And so far, the ones who've done the assessment have done less than that. Have done 13 to 15.
That's awesome. I know, it's pretty cool.
Yeah, I told them this less expensive $800 amalgam is wanting to stick inside these capsules.
It does.
Whereas
It does bad.
I was doing fine till you jinxed me.
It's good. It prepares you for whatever you get out there.
Exactly.
Because you don't know what your doctor's going to use.
She was getting them all, but then when she took the test, it was one that stuck on. Because I was getting them all.
little, big, small condenser, medium. And these new ones, Dr. Lewandowski, only allow you to fill the carrier 1.5 times.
Okay, thank you.
Small end again. So she handed me back the medium end.
I don't need any more after this.
Okay.
Perfect.
So if she did need more, I'm out. So if I tried to put that little nubbins of amalgam in the carrier, it's going to fall out. So she told me, I didn't have to ask her. But if she didn't tell me and she gave me back the carrier, I would say, do you need more amalgam? I'm out, and mix some more. Okay. So she handed me back the medium end. So I gave her the medium end. She used the large. Now she's using the Acorn burnisher to burnish the filling around the cabo surface margin of the prep to make sure it's all smooth in one unit. Sorry, talking and not paying attention.
I'm waiting.
So Explorer, she's going to go around the matrix band to loosen it, just like you're doing kind of with your IRM right now. Then I'm going to give her the Patient cotton pliers because she is going to take out the wedge. And remember I said they're going to be bloody, so have a 2x2. Then she's going to take out the Toffemeyer and then the matrix band, so just stay here. And that's usually bloody also, so leave that over there. Now we're ready to start going through the carvers. So
I just want to stay, sorry.
it's okay. There are 4 carvers on your tray. The interproximal carver is the first one. After you hand that to her, pick up the half Holland back carver and then your suction. Then you need to reach over without, I'm not sucking up her hair, this is not wandering around. Remind me to tell you what Karen called me to tell me last night. You like the discoid end too, don't you? Okay, we both like the discoid end, so it's the more oval shape, not the spade shaped one. So this is a large cleoid discoid, so we want the discoid end facing down, facing the mouth. Then the small. Remember, this is the only time that I said we're gonna go big to small because we're taking off the bulk of the amalgam first, and then we're doing the more detailed carving with the little one. So that's the only time that you're gonna go big to small instead of small to big. This suction in here while they're carving is one of the things that the students forget to do. They'll be passing the carvers, but they'll forget their suction. With the rubber dam on, not a huge issue. Without a rubber dam on, huge issue. It's all falling down into their mouth. So depending on what you're doing and who you're working on, if you forget to do that, it wouldn't be a big deal, though it's going to be a mess. So always suction, and you need to have everything close